All right. Hi and welcome. I'm Jessica Glass, a doctoral candidate in the Department of Exercise, Health, and Sport Sciences at Pennsylvania Western University. My research focuses on integrative and holistic health for military, their families, and really anyone because this information can benefit many. My emphasis is on non-pharmacological strategies to prevent and manage chronic musculoskeletal pain while promoting optimal physical and mental well-being through integrative and holistic approaches. So to help me today, I will be speaking with Jeremy Wetzel. He's an Air Force veteran with 7.5 years of service and completed 2 deployments, one to Iraq and the other to Qatar. After discharging from the military, he obtained his bachelor's in exercise and sports science and is currently obtaining his doctorate of physical therapy degree. So thank you for your service and for joining me today. So I've shared a brief introduction, but could you tell us a little bit more about your military background and experiences?
Yeah, so like you said, I was in the Air Force for 7.5 years. I was in aircraft maintenance, mainly in inspections, and I was very fortunate to be overseas my entire career. So I was in England for 4 years and Italy for 3 years, and I worked on a variety of different aircraft due to my job.
Man, I wish I would have got that when I was in the military. All right. Well, that's awesome. Okay, so nothing with health and wellness, correct?
No, completely the opposite.
All right, so what inspired you to pursue a career in physical therapy then?
Yeah, so during my time in the military, I was also pursuing my bachelor's degree in exercise and sports science. And I was also doing a little bit of personal training, and I was a physical training leader in the Air Force. Basically, people that failed their PT test, I was helping them return to being physically fit in order to be deployment ready, all that military jargon.
Yeah.
And my exercise and sports science, I started researching jobs for it because I didn't want to be a personal trainer my whole life. And I fell into physical therapy, and I really enjoy that you can use your critical thinking skills. It's a very active job, clinical reasoning, and being able to play such a vital role in people's rehabilitation and returning to function and whatever their goals are, whatever they love doing the most. Pain can be very debilitating and stop you from doing what you love, whether that's playing with your grandchildren or farming. Patients have all kinds of different stories, but not being able to do that can really dampen your morale and be rough.
Yeah, and I think that's the biggest thing that kind of got me into this degree and what my research foci is on is because a lot of it is with military, but I realized that we kind of all this information can really help anybody. Um, so that's very interesting. But I actually wanted to bring something up. So there was a study done in 22 in the Military Medicine Journal stating that more than 800,000 service members are affected by a non-combat related musculoskeletal injury annually. What would you recommend listeners to do to minimize their pain, just overall in general?
Yeah, so the general consensus is the things that we hear all the time. So just staying active, doing appropriate warm ups. Don't just jump directly into heavy lifting, of course. A healthy diet, sleep hygiene, ergonomics can be important. So basically, what that means is just your work setup. So if you're always turning to the side while working on the thing, it might not seem a lot, but over 8 hours over the week, that can really start to like cause some pain or lingering, little aches. And just keeping a positive attitude. Catastrophication can really lead to your mind playing tricks on you, making things seem worse than they actually are. So just keeping a positive attitude, keeping morale up around your health can actually be beneficial as well.
Yeah, actually, a lot of with my study is I say physical and mental well-being because it is a lot about physical and just with military, the whole population is they're typically just always active, whether they're training for something, whether they're deployed, they're always working on physical activity. So that's great and all, but one, we got to prevent any injury that we're going to sustain. But then also just on the off time, we're like, okay, well, what are you doing? Are you just sitting down and, playing video games like a lot of
Right.
us? And if we're at work and we're sitting in these awkward positions and then we go home and we stare at a phone or, we're even working out more, but we're not using the right form, then we're ultimately hurting ourselves again. But then that's also why I like talking about mental well-being because just like you said, building up that morale. And I notice a lot of times with military is especially like our lower enlisted, is they have no family. So they can't just go home and just, boost their morale by seeing their children. If they don't have that, then where are they supposed to get it? So just like you said, building that morale with other people. That's great. Thank you. All right, so I want to get a little bit more specific. So there was another study done actually that same year from the European Spine Journal stating that chronic neck pain is second only to the lower back pain as the most common musculoskeletal disorder in North America. But that also aligns with the military population as well, which is why I like always saying, yes, I'm focusing on the military population, but we also have the spouses and the children and the government workers and really anybody can learn from this information because they align so much. So could you share any of your input on specific exercises or just holistic strategies that our listeners can do to help manage specifically low back or neck pain?
Yeah. So um, people always harp on posture. Posture is very important. Like I said, ergonomics. Maybe sitting in an awkward position, as you mentioned, for a short period of time probably won't do anything to you. You'll probably be okay. But for prolonged periods, it can actually add up a lot. Poor posture does not directly predict low back pain, but it can, lead to other things. So in general, most people kind of follow the same patterns of tight muscles and weak muscles. So tight and facilitated and weak and inhibited. So for the cervical region, a lot of people have tight upper traps. People sit in this rounded posture. So tight upper traps, tight pectoral muscles, so they're rounded forward, tight SCMs. And then they have weak deep cervical neck flexors and weak lower traps. So a couple exercises for that. What we learn in physical therapy school is we always want to do one joint up, one joint down. So the cervical region, kind of the highest joint. So, but we do focus on the thoracic region. So really, thoracic mobility can be very important for cervical pain and any kind of deficits like that. So doing exercises like an open book where you're lying on your side and reaching to the other side and coming back, that can be a beneficial exercise. Another one, this is kind of hard to demonstrate over a camera. You would kind of need somebody in person to show you this, but they're called like a cervical head nod. So you don't want to do a full flexion because that's working the muscle that's already tight, your SCM. You want to work your deep cervical neck flexors. So it's like a small little nod like this.
Now, are you
Mhm.
pushing your like a chin tuck? Are you
Yeah.
pushing it back or is it just okay? So you're pushing back and then doing the little
And then a
nod.
nod, correct.
Okay.
You can push back protrusion, and there's other variations of that, but it's just a slight cervical head nod, not a full-on cervical flexion. For your lower traps, another weak muscle, like the I's, Y's, and T's people hear. That's not just your lower trap. Mid trap is like to the side. That's also good to work. And then stretching, doing like yoga, Pilates, relaxation methods of those other tight facilitated muscles is also very important. As for the lower back, people also follow the same kind of general pattern of we're always sitting down, so tight hip flexors in the front here. So stretching those out, and people are also have weak glutes and excuse me, and abdominals. So doing the normal abdominal exercises like everybody hears, crunches, planks, really endurance exercises would be good. And then for glutes, you can do glute bridges, clamshells, banded abductions, monster walks. There's so many for glute exercise, but most people have weak glutes and tight hip flexors. So really focusing on that can kind of be a good start. Anything more than that, if there's any injuries, I do recommend seeing a medical professional to check that out because you don't want to just be, exercising something and it's a mobility deficit that isn't can't
Yeah,
be
just
cured
injure
with medicine.
yourself already more.
Right, exactly.
Yeah. Okay, so it sounds like with the neck, there's a couple things that you can do, and even just if we're constantly looking down, like I said, it's great for military population, but really just anybody with us always on our phone, always looking down, if we could just even just slightly move that to kind of like loosen that up a little bit and stretching. Now I know you said don't go, too far. Now what about stretches? So are the stretches good? Are they not so good? What would you say with that?
So particularly for the cervical region, you don't want to overstretch anything because you can wake up and you always have a stinger in your neck. You don't want to overstretch anything. They do recommend shorter bouts and only a couple times, and then you can kind of progress from there if you would like. But yeah, stretching those muscles, your trap, you can kind of do this. So side bend, and then you look down. Your SCMs, you can side bend one way and look the opposite way, and it
Oh, I think I'm going
stretches
opposite.
your SCMs. So you're stretching those are can be beneficial.
Okay, so now I've also heard, so say we do the stretch, and we don't want to, kink it too much, but is it also if we massage it, is that a good thing? Is that something we should avoid?
No, yeah, massage can be good. Likely with that, they say, make sure you're hydrating. If you do go get a massage can be beneficial. I don't think it's a fix all. You shouldn't just go exactly. Uh, I don't think everybody just needs to go get a massage every week. I don't, maybe that can be good for relaxation, like morale and emotional support. But really getting to the root of it, like I said, even if you work out, you're the biggest bodybuilder in the world. A lot of people do neglect these little muscles. The Mr. Olympia is not in there doing cervical deep neck flexors. They still can fall into these patterns of weak versus
Should.
facilitated muscles.
He should. That's why he should listen to us, right? Teach him a little bit. Okay, perfect. So it sounds like kind of what you discussed is when it comes to the cervical, we can't really work up here, but we can work below. So still doing a couple of things specific to our neck, but also not neglecting our thoracic area. And then kind of goes the same for our lower back is yes, we want to we always want to think, oh, we want to relax and stretch, and we do want to do that, but we also want to strengthen it as well. And then again, we also want to work up, going up to our thoracic. So I guess no matter where you're at, always working your thoracic is always good. Now with the stretches you're talking about, you're referring, so the thoracic ones that you were mentioning, are you saying we should do that maybe like 3 sets of 10 and then progress from there, or what would you recommend?
Yeah, that can be a general start. For these, you're not really looking for strength. So it's not like, oh, I'm going to do 5 pounds and then 10 pounds. You're not increasing like that. It's more about mobility. So even just doing it in like a rhythmic pattern can be good until you feel more mobility in your trunk, your thoracic region. So kind of going by feel, but yeah, 3 sets of 10 can be 3 sets of 20 can be a general recommendation to start with that.
Okay. So are you saying you should add weight to it, or is this something
No.
where you're laying on your back and just doing it more of like kind of feeling a stretch per se?
Right. No, you're not going to be adding weight. No, this is more mobility. Another one that you can do that our anatomy professor always teaches, where you put like a pool noodle vertically on your spine and you lay and you just like on the cross and you stretch out your pectorals because a lot of people are tight here. That helps thoracic, a little bit of mobility, and it stretches out your pectoral muscles. That's
Okay,
another
yeah.
one.
So
You just lay
that's kind of
there
like the
for
same thing
up
where
to 5 minutes.
saying like it goes this way, right?
Correct.
Okay, so that's like kind of like I've taught that on a foam roll, but you're
Yeah.
saying instead of doing that, maybe if you do even a pole noodle, just because it's a little softer, and okay, that's a great idea.
Right. Some people might not be able to get as much opening as a foam roller might allow. So a pool noodle can be, a step down from that, and then maybe they graduate to a foam roller.
Okay. Okay, and then so going a little bit specifically, so a lot of this information would be great for the general population, teenagers especially being on their phone, us always being on our phone. And then with military, because a lot of them are constantly working out and lifting weights, or really just anybody who lifts a lot of weights, this would be good to add before, after. What would you recommend when it comes to like, unit PT?
So yeah, really just whenever you can get it in. As you said, a lot of people are always working out. But when's the last time you work? If you do work out, when's the last time you worked out just lower trap? Basically, that just does scapular depression. Like a Y. Some people do that in a weighted or like a face pull to work the lower traps. But there's these muscles that aren't show muscles that are often neglected. That's why it becomes weak. Same with men. A lot of men don't train their glutes. I know, that's common for females to train in the gym, but men often neglect that. So working these small, stabilizing muscles that we often neglect can go a long way in preventing any potential, aches and pains.
Um, and then you also mentioned posture and just ergonomics. I've seen they have the special chairs that you can get, or even just putting a little pillow behind you, say when you're driving in the car. Do you notice that may help or does it hinder? Do you have any opinion on that?
So it may help some people if they're lacking that mobility. Another thing that I've seen is back to the pool noodle. PTs love this pool noodle, but you cut it into a smaller area and you can put it just in between your scapula. And while you're sitting, it kind of helps you have a proud chest, so you're not as much caving into it. Even if it's just a proprioceptive, you can feel it there, so you're thinking about it. That's
Hmm.
really posture. Static posture. People just will fall into the most comfortable position when you're sitting there for a long period of time. Everybody does it. But this, little thing can just help you really just think about having a better posture. So even just that cue may help.
So at the beginning, you said posture may not be one of the biggest contributing factors to pain, but it is something we still need to worry about and always working on that posture, trying to get it better. But know that that's just something we naturally need to do, whether we have pain or not.
Right. So yeah,
Correct?
posture doesn't directly predict
Influence.
low back pain
Okay.
or cervical pain. Just because you have bad posture doesn't mean, oh, that guy's going to have low back pain. That's, what I'm saying, but it could play a role in it. They also say that pain does not necessarily mean there's tissue damage, there's structural damage. So just because you have a little bit of pain in your low back doesn't mean like your joint, you have osteoarthritis in your joint,
Yeah.
just because it has a little pain there.
And this is when we need to come to see you or go to the doctor.
Exactly. This is why you need to see a medical professional.
Yeah. Okay. All right. Well, perfect. No, we've covered a lot of valuable information, but is there any final tips or something that we haven't really mentioned that you would like to leave with our listeners?
Let's go back to Google is not a reliable source. Even if you think you know your own symptoms, there's so many, factors. How long it's been going on? Do you have any radicular pain, basically going down your arm? Cervical pain, one of the key, symptoms that people might have is radicular pain in down to their hands, carpal tunnel, things like that. A lot sometimes starts in your neck, your brachial plexus. Um, but there's different things. So like a lot of people hear, oh, traction for low back pain. That might help, but if you have spondylolisthesis and you have slippage of your vertebrae, which people don't know about unless you get an X-ray, that's the worst thing you can do is traction. And
Okay.
back to imaging X-rays, I actually have a study here too that they gave us. I can share it with you. But by the time you're 30, 52% of people have disc degeneration. And by the time you're 50, 80% of people. So a lot of times, yes, you can go get an X-ray, MRI, but chances are it's going to show something, even if you're asymptomatic. And back to the catastrophication, people hear, oh, I got a slip disc. Even though they weren't painful before, they went into, to get a X-ray, MRI, and something else, and they see that slip disc. Now they're thinking, oh, maybe I do have back pain, and thinking like that. Secondary, another study I have. So they did a study on young Air Force flight cadets, 18 to 22-year-olds. So they did 350 asymptomatic people, so no pain, no reported pain, and 30% of people had disc desiccation, and 13% of people have at least one disc narrowing. So basically, the disc is shortened,
Hmm.
shrinking. Basically,
Like
what happens
arthritis
when
a
you
little
get
bit.
older. Exactly, and that's
Hmm.
asymptomatic people. So if they hear that, oh, they have a disc problem, they can start to catastrophize in their mind.
So it's interesting that you brought that up, and I'll definitely be stealing that article from you. But a lot of what I teach is, yes, we need to have all these holistic strategies that we're going to just help ourselves. But a big thing is pain education. And, I think one of the biggest things they say in the military is, embrace the suck or, oh, no pain, no gain, or,
Right.
there's all this different terminology for basically just dealing with it. Um, and you can look at that as good or bad because just like you're saying with these studies is we may not think we are in pain, but then as soon as we find out we have an issue, oh God, now we're hurting, right? But then also there's a lot of research out there right now that you can also kind of change your mindset. You may feel that you have pain, and no, you're not just faking it, and you're not just believing you have it, because if you believe you have it, then you're going to feel it. But just re-altering uh kind of your thought process with like cognitive behavioral therapy or cognitive functional therapy. If you rewire your brain, then you can start to learn that, hey, it's okay. It's not, oh, if I feel something, oh my God, this is a traumatic event and I got to go figure it out, right? But it's just trying to learn how to kind of live with it, but also, just kind of going back to all the stuff that you taught us about and helping yourself with that, but then also realizing that, hey, it's okay. Let's try to rewire, figure this out, use all these holistic strategies that we have in our toolkit, and just learn how to live life and not stress about it so much.
Right. Yeah, I'm glad you said that. Neuroscience is, you know, amazing if you learn about it. Pain science, neuroscience in general. But exactly like you said, rewiring your brain can do a lot. So that's why patient education in the field of physical therapy, in medical field, in your field, can go a long way in just educating patients that, like I said, pain doesn't always mean there's tissue damage. You could just have a muscle knot, something that's not as severe. It's not always a joint, arthritis that you're having. And it can really, reframe your mind into helping with pain.
So, question now that I'm thinking about it. So, say you have a client and they were asymptomatic. You probably don't know this at the time, but they say, okay, here's my imaging and I have a slip disc using your example and I'm in pain. And they come to you. And you really don't know that they were asymptomatic before. I'm assuming you just treat what you see, correct? Now, do you think that will benefit them? Do you think it really is all, hey, you're going to also need to learn some pain education? What would you do in that situation?
It kind of takes a holistic approach. So, well, we would treat the ailment. So, if you do have pain in certain, movement patterns, you can kind of disc has, a very specific movement pattern. So, you have pain with sagittal movement, so flexion of the at the waist. Um, so you kind of can help target those areas. I do think it'll help them because a lot of what we do is graded exercise, basically with the knowledge of what we're doing behind the scenes. And I think pretty much everybody will benefit from additional exercise, mobility. If they have tight, hip flexors, weak glutes, and we work on that, even if that's not the exact, cause of their slip disc, I think it'll still be beneficial.
Yeah, just always helping them out. And then I think also kind of like the, not necessarily a placebo effect, but okay, here's my issue. I'm doing something about it. What do you know? I feel better. So, I mean, that alone can kind of help them.
Right.
Okay.
And yeah, patient education is always important, but the placebo effect, patient buy-in, if the patient goes to PT, because a lot of people are told, oh, I have to go to 8 weeks of PT before I can get back surgery. If they go in thinking like, well, I just have to be here for 8 weeks, it's not going to get better. But research shows that PT can help alleviate these problems and maybe delay or prevent surgery in the back completely. Back surgery is not the most reliable, consistent thing out there. A lot of people who end up having surgery just continue to have pain long after the fact, or it
Then they
leads
still go
to
back to you.
exactly, and they still come. So going into these, therapy, physical therapy, or anything like that with a positive mind and open, mind, thinking that this could help. This, could help relieve my pain. Could go a long way.
Nice. That's awesome. Okay. Well, I know I said this earlier, but now that we kind of went on this whole other tangent, is there anything else that you want to add in?
No, I think that one's it.
We covered it. All
Yeah.
right. Well, thank you so much. It's been a pleasure speaking with you. Thank
Thank
you
you.
again for your service and for sharing your knowledge with our audience. All right. So for the articles that I mentioned in this episode, as well as Jeremy Wetzel, I've included the reference materials in the notes. If you have any further questions or comments, please feel free to contact me. I'd love to hear from you. Thank you all for your time and attention.
Thank you.